if it's coming from somebody online with a discount code, probably not a good idea.
Okay.
Even if they have a COA attached to it, that piece of paper doesn't necessarily mean anything by itself.
Health and wellness is confusing. There's a new trend every week. Everyone's got an opinion, and half the time you can't tell what's legit from what's just good marketing. And we get it. We're in it too. Welcome to Dialed In Health. I'm Melissa Goodwin. Every episode, we bring in the people who actually do this work. Providers, practitioners, the experts who see clients and patients every day. We ask the questions you'd ask if you were sitting across from them so you can find the right people, make better decisions, and feel confident about what's out there. Whether it's peptides, gut health, water quality, ADHD, biohacking, or something you've never heard of, we're covering it. So let's get into it. Let's get dialed in. If you've seen peptides all over TikTok, Facebook groups, Instagram, and wondered what exactly is a peptide? Is it something that's for me, or are they even safe? Today, this episode is made just for you. We are sitting down with Ashley Wagner, the owner of Vitalis Movement and Wellness. And Ashley's done a ton of research. She has one of the peptide therapy clinics here in Sioux Falls, actually in Harrisburg is where we are. And you have a practice that's individualized, medically supervised, and also they make sure that everything is sourced properly. So I'm excited to have you on the show. Yes, welcome, Ashley.
Thank you.
So glad that you're on Dialed In Health. Why don't you tell us a little bit about how you got started with Vitalis Movement and Wellness? Before we get into just the peptides, tell us a little bit about your business and all the things that you do here.
Yeah, so small town South Dakota girl, raised on a farm, about an hour from here. So throughout my nursing history, I graduated from nursing school in 2013. I have gone through, I've worked like neurosurge, GI, urgent care, and then just, it was kind of one of those weird situations where once you get done with nursing school, everybody asks, like, when are you going on to NP school? I said, never. Zero desire to be an NP. And then next thing I knew, I was in NP school. And then after I got done with NP school, they're like, oh, you're in a private practice state. When are you going to open up your own business? I was like, absolutely not. Never. Zero desire to own my own business. And well, here we are. But just kind of like through my research, through things, I was just kind of seeing different things that I was like, I don't know if I agree with that. And also, that's not how I want to do things. Like, and I didn't really want to be regulated or told how to do my job when it wasn't something I believed in. So kind of with the whole peptide thing and how I got going there was a little bit more on the side of them being natural. Mm-hmm. Like I've been kind of on that crunchy, scrunchy lifestyle for about 8 years now. And then as for Vitalis, it just kind of started that way. So my husband and I, when we moved our family back from Rapid City, where we lived for almost 8 years, kind of just fell into that realm of not really wanting to work for anybody. We wanted to kind of be our own boss, run our business how we wanted to. So we kind of were like, collaborate. Like, let's see. I'm doing more like the natural functional medicine type stuff. He's doing more the pain type stuff. Kind of really started figuring out how these things can really collide. And then that's where Vitalis was born, I guess. So really it comes from the true meaning of Vitalis, the definition. So it means life-giving. So the whole goal and purpose of our clinic is just to give you your life back.
You do a lot of things here at Vitalis. Let's talk a little bit more about peptides. So what exactly is a peptide and what is it doing?
Yes. So peptides are just little short chains of amino acids. Okay. So what we're doing is using these little signal messengers to send messages to the body to stimulate it to do something. So I like to think of it as basically, you think of it as a text message. Like you're texting your brain, telling your body what to do. Like,
okay.
Depending on which pathway we're going down, what peptide we're using, it's going to signal different things. So we can signal it to like release growth hormones, appetite suppression, muscle tissue recovery type stuff. It just kind of depends on where we're at.
So how is a peptide different than a hormone?
So peptides and hormones act very differently on the body. So peptides are very direct and they can actually penetrate the cell membrane, whereas hormones are a lot more broad. So you think of it like a broad spectrum antibiotic. Like we know you have an infection of some sort, right? We're just going to send you this antibiotic. It covers XYZ bacteria, right? That's kind of what a hormone is. Like we supplement a hormone, we're covering, maybe it's estrogen, progesterone, testosterone, like whatever. But it's also downfall trickling to like thyroid hormone, vitamin D is a hormone, like some of those types of things. Insulin's a hormone. So it's more of what we call like an umbrella effect.
Okay.
With hormones, where peptides are very direct and we're signaling one specific pathway to do one specific job.
So the number one question on Google when you start to like type in peptides is which peptide is the best for weight loss?
Yes. I get that a lot.
Yeah.
Honestly, not a great Google or question in general.
Okay.
Because there is no one peptide that is great for everybody for peptide or for weight loss in general. We all have very different lifestyles, different bodies, different histories. So there's really not one that you can necessarily say is the best.
Okay.
Really how you need to break it down is why, you need to dive deeper. Like, what's the reason that we're not losing weight? And that's really where that comprehensive lab panel comes in, where we're testing hormones, vitamin deficiencies, seeing how the thyroid's doing, all of that type of stuff, so that we can determine what the holdup is, especially in somebody who's doing proper exercise, nutrition. But really, once you start conversing with people, sometimes it's like, no, you're doing too many HIIT workouts, or, there's just different things there where we're not always maximizing what we can do. There are certain ones that, yes, will stimulate, and that's where you kind of figure out, is it a food noise problem? So, okay, then that's a specific peptide that's going to help more with food noise and appetite suppressant. Is it more of an energy problem? Are you not losing weight because you're not moving because you don't have energy? So we ask you to attack that side of things. Is it an inflammatory issue? Do you just have a lot of inflammation and toxin buildup that we need to move fluid? Mm-hmm. So it kind of just depends.
So if there's someone, because I feel like you see something about a peptide and they call you and say, hey, Ashley, I want to do, and they all sound like Star Trek names to me, like BPC, BP, whatever, blah, 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 157. I'm like, how do people remember this, first of all? But if somebody calls you and says, can I get that peptide? What's your first thing that you do with them?
Yes, we still need to sit down and do that consult.
Yep.
Because I do need to know what medications they're on, what other supplements they're taking, if they've tried anything before. Can you inject yourself? Different little things like that, which peptides come in different forms. So that's not always a big, it is kind of a holdup, but we can get around different things.
Okay.
But really we need to schedule that 30-minute little consult to just chit chat. What are your goals? Why do you want one BPC 157?
Right. So what are all the things that you might use a peptide for?
Oh, man. Well, with there being so many of them, there are lots of different things. I would say kind of the most common things. There's anxiety, depression, there's ADHD, there's weight loss, there's body composition. There's kind of the glow up hair, skin, and nail type things that we can do. I'm missing the muscle tendon ligament repair type stuff.
Okay.
Gut health. We can help heal the gut lining with peptides.
So this is a dumb question. How does the peptide, so you just inject it in your leg?
So they're all subcutaneous.
Okay.
So you have different injection sites. So usually the most common is subcutaneously in the abdomen.
Okay.
You can also do back of the arm or outside of upper thigh, yes.
So how does it know where to go? If you have a shoulder pain and you're like, here's the peptide, how does it know to get to your shoulders?
So that's where it depends which peptide we're using.
Okay.
So if we're actually using something like BPC 157 that is utilized to help with muscle tendon ligament repair, that one we would specifically inject to the muscle that we are targeting.
Okay.
So you can inject them more in the abdomen is more of a systemic effect, but in the if you have a specific location, then we're directing it right there. But again, really, because it's a little tiny messenger sending signals to the body,
sure,
you're sending by putting it in the body recognizes it because it already knows it. It's natural. So it uses that then to stimulate that pathway in the body and direct it where it needs to go.
So there's lots of different uses for it. How long does it last? How often do I have to inject myself, or what is that? Is it every day? Is it every week?
So that depends. Some are daily, some are weekly, some you cycle on and off. Ideally, in my practice, nobody is on a peptide long term. Okay. Because again, our goal is just to stimulate the body to do its job. And then we don't need to worry about it anymore, right? As soon as the body remembers to do its job, okay, this is how we do it, then it's all taken care of. Once in a while you do need to go back and do things. So there are certain ones that you might do only 1 or 2 days a week, and you do that once a quarter. Certain more detoxing type things or inflammatory type things, more the anti-aging type things are a little bit more spread out and doing them more quarterly. Those aren't the ones that you can do regularly. But like BPC, for example, is one that you would do daily for a period of time, but then you do need to take a break from them. They're not something that you should be on long term. Ever. No.
So tell me about the growth hormone, the human. So that's a peptide. Is this, or tell me about this is a big thing. Evidently, I don't know enough about it. So tell me, what are people using it for? And, the good, bad, and the ugly about it.
Yes. So the peptides that we use for like growth hormone, we're not actually injecting growth hormone.
Okay.
We are injecting on something that we are signaling the body to release its own growth hormone.
Okay.
So that's where this one is very specific on the timing and how you do it.
So the text message is actually sending a message to the body to do
to the pituitary.
Okay.
To stimulate natural releasing growth hormone.
Okay.
So your body should naturally release little pulses of growth hormone at night, typically around 10 p.m. So with this one specifically, you need to inject it before 10 p.m. Ideally. And then what it's going to do is it's really a well-rounded one, especially if we're kind of stacking things, to help with sleep, recovery, body composition. It kind of helps build muscle, burn fat type of thing. However, they can also be a little bit dangerous. Like this is one that you really do need to monitor your lab work very closely on. Okay. Specifically males. In males, that can increase their prolactin levels, which will actually cause some sexual dysfunction. So males, if they get too much too fast or too high doses or anything like that, they can complain of not being able to finish.
Okay.
Or their recovery time, like in between orgasms, is a lot longer.
Okay.
So it's not that they have a dysfunction where they can't perform. It's just that they can't finish. And that can just be very debilitating. Frustrating and just unsafe. Like you don't want to have those high levels. So you just have to be really careful with them. They're not necessarily for everybody, and just safe practice dosing.
So what do people love about that peptide that signals the growth hormone? Why is that such a big deal?
Because you feel amazing. I mean, all around well body. Like it is, people just in general, know that they just feel so much better. Their skin looks better. They have way more energy. Their workouts are going further. Like you can work out and lift twice as much as you maybe could before, but you're not noticing the soreness because your recovery is better.
Okay.
So it's just kind of all around. You get much better sleep. So then that helps with your recovery too. Like, so it kind of all comes full circle, really.
So it doesn't make you actually grow. Quick break. This episode is brought to you by Vitality Growth Labs. If you're a health or wellness practice and you're wondering why your phone isn't ringing the way it should be, Vitality Growth Labs builds the systems to fix that. Get found, build trust, fill your calendar. AI authority stacking, videos that connect with your clients, real tools, strategy, and execution that results in real revenue. Visit vitalitygrowthlabs.com or check the provider directory at vitalitygrowthlabs.com/the directory to find a trusted wellness provider near you. All right, back to the show. So for women, especially women, and we're starting the journey into maybe perimenopause or menopause, how are peptides helpful for them? Or is it peptides versus hormone replacement therapy, peptides with hormone replacement therapy? How does that work?
Yeah, so I guess kind of in that phase of women's life, a big thing that I hear them complaining about is that mid-abdominal weight gain, the troubles with sleeping. Maybe that's because of hot flashes, night sweats, or maybe that's just they're just not sleeping anymore. They can fall asleep because they're exhausted and then they're up at 3 a.m. Maybe that's more of a cortisol issue than it really is a, sex hormone type thing. But so really with the peptide side of things on that, I'm really starting to address more those symptoms and those problems than I am actually like the hormonal side of things.
Okay.
I think it's very different, the like hormone therapy versus peptide therapy, just because peptide therapy is again more that direct, like we're treating the symptoms and those types of things, where hormones, yes, if they have a true deficiency, so if their big symptoms are the hot flashes, the night sweats, the vaginal dryness, all of that type of stuff, then they probably do have a true hormone deficiency and need, like a replacement therapy.
Okay.
However that looks like for them. But from the peptide side, we're really just addressing the symptoms, which is giving them that overall well feeling, which then can target those other symptoms. Because really, when you're giving those peptides, even though it's sending direct pathways, it's not necessarily stimulating like hormone replacement, but overall your body's functioning better. So then you're feeling better.
Got it. So tell me about the stacks. Some of these stacks also have crazy days. So what is this? What is a peptide stack? And, tell me how you approach that and what kind of how you navigate that with patients.
Yeah. So peptide stacking is honestly, I call it peptide math. So we know girl math, right? Where we get lots to pay for anything.
I wish that worked for me. I know, right? It doesn't seem to work for me.
I haven't figured it out either, but TikTok has. So whenever I learn from them. But I consider stacking peptide math. It's like 1 + 1 = 4.
Okay.
In a safe manner, of course. So sometimes what can be beneficial with stacking is we are directing more than one pathway at once. So if we get somebody come in, like, say, the perimenopause or the menopause, and it's like, okay, we got the whole gamut of problems, right? We can't sleep, we're gaining weight, we have no energy, our thyroid's out of whack, we're on all these prescriptions, blah, 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 blah. It's kind of like, oh boy, where do we start? Okay, so now we have all these different pathways that need to be activated that have been not activated for so long that we've kind of created a little bit of a train wreck. What's nice about stacking is you can actually use smaller doses of stuff, but get more bang for your buck. Okay, so we stack certain things to target certain pathways that work together. So a big stack is like your CJC apomorelin, and you can stack that with BPC 157. Or you can also do like CJC apomorelin with like retatrutide to kind of get that body composition back, but also accelerate the weight loss part if that's kind of what they're looking for and what their body needs. What's nice about it is, we're just getting the best of both worlds, really.
I don't know how you keep all these names straight in your head. Like, it is so crazy.
Lots of research.
Yeah.
The problem is stacking can also be very dangerous. So a lot of these stacks, are like the ones that seem to get used the most anyways, are all of them that drive like insulin, glucose. Like, I mean, we hear the insulin resistance, but we're buzzword, all the time.
Yeah.
So people see, oh, it lowers my glucose. It's got to be good for me, right?
Right.
Well, next thing you know, you're on 3 different things that all are affecting your glucose. Now we're really dangerous because now we're having hypoglycemic, like our blood sugar is getting too low, and that's dangerous.
You pass out or whatever that.
Yeah, you can pass out. You can start having some really medical complications.
Okay.
You gotta watch your liver, your kidney, like different things. This year, like, what are we stimulating? What are we not stimulating? And also, when you're doing too many stacks or too high of doses, you're getting like too much of a buildup of a certain amino acid or peptide in your body. And then that can be dangerous also, because then your body isn't able to actually like go down those pathways anymore because it's just seeing too much. And it's like, whoa, hold on.
Sure.
Now we're essentially overdosed.
So what I'm hearing and what's interesting is I see influencers all over the place that sell, I don't know if it's peptides, maybe it is peptides, but they're like, send me or whatever, I'll give you the code for my GLP-1 or my peptide stack or whatever that might be. And, people order those off of TikTok and Instagram and Reddit threads and all of that, but they're not necessarily measuring what's really going on in their body. So that's kind of terrifying.
Yes, it is completely terrifying. The scary part with that is they don't know sources necessarily. We don't know what's actually in that vial or how concentrated it is, if it's diluted or, you just don't really know what you're getting, and that's really scary. And then at that point, you have no medical oversight. Like, you don't know how it's being dosed. You don't know what the contraindications are. Like, certain peptides are contraindicated for certain people for certain reasons. Even FDA approved, like GLP-1s, have contraindications. Like medullary cancer or thyroid cancer, like, you cannot take a GLP-1 if you have a family history or a history of that. Okay. And some people probably don't know that. So, and obviously the influencer posting that doesn't know that you have that history. So that's where really this medical oversight is really important, to know the history, know what things can go together, what medications are contraindications, and all of that type of stuff.
Yeah, and if you don't have labs done, you never really, like, I would imagine people just probably order it and like, hey, it's working for me until it doesn't. Then they order something else, right? Which is, just because it's natural doesn't necessarily mean it's always, you can still overdose on natural things.
Correct. I mean,
Different ways, right?
yeah. I kind of say the same thing with like, just because something's organic doesn't mean it's for everybody.
Right.
Right? Like, you could eat too many Brazil nuts and overdose on selenium. Even though they're raw and organic and they are supposed to be healthy, well, that doesn't mean that you can't do them wrong or
You might be allergic to it. Who knows?
yes,
right? All kinds of things.
So it's kind
that-
of the same attitude with peptides, I guess.
So if someone wants to start, they say like, hey, like we talked a little bit earlier about if somebody calls and says, I want BP 157. Your first step is to come in and do a lab. And, if they were like, hey, I really want to lose weight and I want great skin, what do you, what's that process? What's the time length of the lab and how long you have to wait before you actually are able to start doing that injections?
Yeah, so that's going to depend on the peptide because not all peptides require labs. And it really just depends on which ones we're really looking for. So that's great. We do that first 30-minute consult just to determine what goals are, what we need. And then it depends on we're taking a full medical history at that point too, like family history, personal history, what supplements are you on, what medications are you on? And then from there, that's when I can figure out kind of what your goals are, what you're dealing with. And then I'm kind of in my head already starting to figure out maybe what you need. So that I'm putting together a lab panel. And then based on that, we get the labs drawn. So depending on what supplements they're on, you do need to be off certain supplements for a week before we can do some of these comprehensive lab panels. Otherwise, we get false highs. So if you took a supplement this morning or last night, and then you come in this morning for a lab draw, that supplement might still be circulating in your bloodstream. So then when I get those lab results, it's going to show that your vitamin D is maybe at 65, when realistically it's not. It's lower. You're getting false results. So I do require everybody to be off their supplements for about a week. And then after we get the lab results, we meet a week later to go over them and then finalize the plan. So really, we're looking probably about 3 weeks from start to first injection or going home with peptides is approximately the process.
It feels very like on the bleeding edge of things, but I'm assuming peptides have been around for a while. Are they safe?
Yeah.
Can you speak to the safety and legality of peptides?
So peptides have been around for quite a while. Other countries have been utilizing them for a lot longer than us. And we do have some, a list of FDA approved now, which is kind of nice. It makes the accessibility a little bit easier. That doesn't necessarily mean them safe or necessarily legal always either, depending on where you're getting them from. Okay. So your big things you really need to just pay attention to, first of all, if it's coming from somebody online with a discount code, probably not a good idea.
Okay.
Even if they have a COA attached to it, that piece of paper doesn't necessarily mean anything by itself. You need to still have a reputable source, a pharmacist that's been around for a long time. A lot of these websites with deep discount codes and stuff, it might be under this website today, but next month, all of a sudden you go to it and the website's gone. And then it'll say, coming soon, visit us over here. And then they have to send you somewhere else. That's a huge red flag. If they're being shut down for something, then they're obviously not doing something right. So that's what's coming from there. So just really making sure you have a good source. 503A, 503B pharmacies. Yes, they're compounding, but they're compounded under a special legal framework. That there's certain things that they have to follow, that they have to report, hoops that they have to jump through, to verify their products and that type of stuff. So that's where we really, know what we're getting and that what is on the label is actually what's in the jar.
So, if you go to your traditional doctor and you say I want some peptides, what will they typically tell you?
So typically, because unless they're an FDA approved one that they can write a script through, they would tell you they probably can't help you.
Yeah.
Also, most of your traditional, your primary care providers that aren't trained in them, so they don't also know how to prescribe them, dose them, all of that type of stuff.
So tell me about your training. What did you do to get all of this information, know where to source things, know how to administer things, know how to navigate that with patients?
Yes. So I started just doing a lot of research by myself on reputable websites, medical journals and websites and that type of stuff. Took a like a practitioner specific certified course
Okay.
on it. Did some more research. Started playing with them a little bit myself beforehand, so that I understood the process, how they make you feel when you inject them, what things I notice. Granted, my situation's not going to be the same as everybody. I'm not going to react the same as everybody, but then I can at least like relate to the patient and be able to tell them like, yeah, when I did it, this is what I noticed. Or yeah, that one might burn a little bit more than the next one, or, different things like that. But overall, it does just kind of gave me a good grasp on it. And then I also, when it came to like prescribing them or getting them in patients' hands, I worked with our South Dakota Board of Pharmacy. Well, kind of starting with the Board of Nursing first, like, okay, what's legal here? Like, what can I do? What are we seeing coming up the pipeline? Like, what is legislature saying about these types of things? So I started with them, and then they referred me over to the Board of Pharmacology. So I was working with some individuals there who were like, yes, from the whole like dispensing side of things, like, this is how you do it. And I mean, being a nurse, I've taught patients how to give themselves insulin injections and stuff like that. They're very similar. I mean, we're using insulin needles. So I teach them, like, this is your syringe. This is what your dose looks like. Like, this is what each mark on the syringe means. All my patients do self-injection demonstrations in clinic before they are sent home with them. Because I need to make sure you know what you're doing and you're doing it right. I give them all their supplies, their sharps containers, the proper disposal. Everything is reviewed.
Okay.
How to store them, everything like that. So that's all reviewed before they go home, so that they go home completely confident and they can just call me if they ever have a question. Like, they're never alone in it, or hopefully never having to feel like they have to resort to Google or anything like that for information to how do I do this?
So what if you don't like needles though? What if you're like,
Yes, so that can be a little bit of a barrier for some of them. Most peptides are not absorbed well orally because they're those tiny chains of amino acids. They break down very, very easily.
Okay.
So most of them cannot stand to go through the stomach. The stomach acid just destroys them right away, and then they're never absorbed, and that's a huge waste. So your absorption is always going to be best injected. There are some topicals. There are some nasal sprays. Again, are they as great as the injections? No, but there are options and things that we can work around.
Okay, Ashley, I have a few true or false questions for you. You can tell me if these things are true or false as it relates to peptides. Peptides are basically the same thing as steroids.
False. They act very differently on the body. So peptides are amino acid chains, where steroids are actually cholesterol-derived molecules.
Okay. Here's another one. There's one peptide that works for everyone.
False. Everybody's physiology is different. Everybody's lifestyle is different.
So if it has a certificate of analysis, that means it's safe?
No, that does not verify their integrity, that they're sterile, or really that what's in the vial matches that piece of paper that they're canning out.
So how do you know if it is legitimately sourced?
Coming from a reputable pharmacy that has been around for a very long time.
GLP-1s like Ozempic and Wegovy are peptides.
Partially, yes. They are derived from peptides, but the GLP-1s are very heavily modified. So they are modified to actually lengthen their duration, basically. So that's why those ones are only once a week instead.
All peptides are injections. We did talk about this a little bit. I'm scared of needles, so I can't use any peptides.
False. We can still get you topical, nasal, or, sometimes it's, here, let me just give you a quick little injection, see what it feels like. And most people are surprised by the fact that it doesn't hurt. You can't feel it. So do a little training. Sometimes people can get over that.
Okay. Peptides are unregulated and illegal.
False. As long as they're coming from a pharmacy with good framework, you can get, like a 503A pharmacy. We are writing prescriptions for them. So they're being dispensed to a specific patient, and that is very legal.
Last one. I can double my dose and get better results.
Absolutely not. That is how we have medical errors, bad side effects. That's where people can get sometimes a bad take on peptides because of a bad side effect.
So my last question is, if you could have a billboard about peptides and you could put it up where people could see it, what would your billboard say?
Our billboard say, okay. So I guess my biggest thing would be they're not magic. You need to have the right peptide for the right person, right dose, right time.
That's a bummer because I want something magical. So, Well, why don't you let us know, for those that maybe want to get a hold of you, that are more interested in learning more about peptides, tell us where they can find you on the web and in person. Where do they find Ashley at Vitalis Movement?
Yeah, so we post a lot of information on our Instagram. So that is just at vitaliswellness.life. We also, you can find like a book now button for online booking on our website at vitaliswellness.life as well. Or you can give us a call, 605-767-1601.
That's amazing. Well, thank you so much, Ashley. Hey, that's our show. If someone came to mind while you were listening to this, if you thought, hey, my sister needs to hear this, or I should send this to my mom, or my buddy would get a lot out of this, please share it with them. Just hit the share button and send it their way. You never know what one conversation, one episode, or one piece of information can do for someone who's been looking for answers. And if you haven't subscribed yet, please do it now. It takes 2 seconds, it's free, and it means you won't miss an episode. We've got incredible stuff coming up, and I don't want you to miss any of it. And if you're a health or wellness provider and you want to be on the show, we'd love to hear from you. There's a link in the show notes to get in touch. We're always looking for people doing interesting work who want to share what they know. And one last thing, I get asked all the time about the products and brands I actually use, so I put together a list of sponsors and favorite products that have worked for me and my family. If you're curious, that link is in the show notes too. Thank you for being here, and I really mean that. I'm Melissa Goodwin. The line is open. See you next time.